A new study has found late-stage cancers decreased 12% in groups where AI screening was implemented, suggesting AI could become a new wave for medical breakthroughs. Here to talk about this technology's ability to detect and prevent breast cancer is Jean Seely, head of the breast imaging section at Ottawa Hospital Research Institute. Kyle also here in studio to join us for this conversation. Jean, it's good to have you. Thanks for taking the time.
Thank you for having me.
This is really interesting. I'm wondering, first of all, if you can explain exactly how this works when it comes to breast cancer screening and implementing AI.
Well, the study that we're talking about was done in Sweden, and they implemented it for a population-based screening program where they usually in their country do double reading, where two radiologists read the mammograms and then decide whether or not they need to call back the patient for additional imaging. Instead of using a second human radiologist reader, they added AI, and for the cases where the AI flagged the mammograms as being higher risk for getting breast cancer, they studied the impact. And what they found was having the second reader as being the AI actually improved the performance of the overall program and reduced the late stage, the delayed or advanced interval cancers by 12%, as you mentioned. So
Wow.
This is a really positive step to show that AI helping the radiologist actually improves the performance of the program.
No kidding. I'm wondering, obviously we'll be seeing more of this, I'm sure, in the future. And you suggested that this technology can actually save public health dollars as well. Do you have an estimate in terms of how much we could see?
Well, we did a study a couple years ago looking at the cost of diagnosing breast cancer according to the stage at diagnosis and using Canadian healthcare dollars. And when we diagnose early stage breast cancer, it costs about $40,000 to $50,000 per patient. But the moment we get into the later stage, for example, the stage 3, which are more likely to be the delayed ones missed by the mammograms, those have a cost of over $200,000. And by the time it's already spread to the rest of the body, we can be in over $360,000 to $500,000. So when we add those costs up, using AI to help us reduce those late stage diagnoses will actually potentially save healthcare dollars.
Jean, what sort of adoption are you seeing with AI in hospitals?
I think you were saying what's the uptake?
What sort of adoption are you seeing at the hospital level to use AI, whether that's enhancing patient experiences or on the research?
It's a great question. It's still early. We have been using it at the Ottawa Hospital for the last year and a half, where I was able to use research funds to actually allow us to study the impact of adding AI to our screening mammograms. It's really early to say, but we are not finding that it increases the false positives when the radiologists are trained properly on how to use it. There is no way that we are ready to use AI as an alternative to radiologists. There are too many false positives where it would recall too many cases. But using it with the radiologist seems to help it, and we are starting to see this across the country where slowly people different radiology practices are starting to use AI to look at how they can improve their performance.
Okay, that was going to be something I wanted to follow up on too, right? Is this study is based overseas, as you mentioned, but how often are we seeing, or how many areas of Canada are we seeing this technology slowly starting to be used? And to your point, not alone, but with a radiologist?
Yeah, it's still early, and I would say there's a lot of interest. We're starting at many of the radiology conferences. We're starting to have talks on how this can be adopted. There's obviously the cost of implementing AI. There's there's a lot of hesitation to use it because it has this kind of black box phenomenon. We don't know exactly how it works, and we have to study its impact on human behavior. We can't rely only on AI, and so there's a learning process. So I would say it's still fairly early, but I think it's very promising, and certainly from our experience, early as it is, it's helping us. And certainly from this study from Sweden, this is very encouraging that it's going to help improve the quality of screening mammography and early detection of breast cancer.
No kidding. You mentioned this, though, and I just wanted to dive deeper into that question of how much the actual technology costs. Can you give us a better idea of how much that
It's
costs?
so variable, and it's also changing, and there are different, and luckily Health Canada will have approval processes for all of the new vendors that are coming out. It's all validated, tested. So it varies depending on how many patients you're doing, how many mammogram units you're doing. It's not insubstantial, and you have to integrate it into the systems to allow the radiologist to see this when they're working. That requires a fair bit of work to implement this. So I would say we probably need help with implementing this across the country. I would like to see us do this more at the programmatic levels in the screening programs, so that we can benefit all of the people in the screening programs, not just in a few centers.
And I'm assuming a lot of patients would obviously like to see more of this. Like, have you heard positive feedback so far from women across Canada who know that this could be more available in the future?
I think, and in speaking to my patients, they want us to be able to do the best job possible with the technology that we have. So if it's going to help and improve the quality of the imaging, then the patients would like it. We know from surveys that patients do not want radiologists replaced by AI. They want to have oversight. And I think that's exactly the way we're going certainly in Canada and many parts of the world. It is not ready. We need to have the radiologists integrate with the AI as this very valuable tool to help improve the quality.
So great to hear that there's an even more hopeful future on that front coming up. Okay, that's all the time we have. Jean Seeley, though, head of the breast imaging section at Ottawa Hospital Research Institute. Thanks so much for joining us this morning.
Thank you for having me.